It's a pleasure to talk about this important topic. My name is Johannes Schetelig. I'm the head of the cell therapy unit at the Technical University Dresden, and at the same time, I chair the clinical trials unit of DKMS. And one major activity of this clinical trials unit is to host a large biobank. But let me first start with a little bit of background on NK alloreactivity. So when we think of transplantation, we often think of T cells as the major effector cells, which might eradicate residual leukemia or lymphoma cells. However, we think that natural killer cells, briefly NK cells, also contribute to gaining disease control and maintaining disease control after transplantation. We do have insights on the power of natural killer cells from NK cell transfusions, which have, in patients with acute myeloid leukemia, surprising efficacy. There have been studies and small case series of patients who received such natural killer cells from their haploidentical related donors, and complete remissions even were observed after such transfusions. So NK cells have the potential to kill leukemia cells. And the question is it possible to predict their impact after allogeneic transplantation? And in order to do so, receptors on the surface of natural killer cells might be a clue, because whether or not an NK cell kills a target cell depends on the net sum of signals this natural killer cell receives through receptors, which may be either activating or inhibitory. And a major group of receptors on the surface of natural killer cells are so-called killer immunoglobulin-like receptors, or briefly KIRs. So there are many of those KIRs, and the KIR genotype is surprisingly complex and only partly understood in terms of in biology, in, let's say, health and disease. It is perhaps not as complex as the HLA system, but it is complex. And it is, as I said, only partly understood, which immediately means that we don't have perfect models to predict the impact of certain combinations of activating and inhibitory KIR receptors in the genome of a donor. However, there has been a lot of research, and there was great promise in this topic because of the observations which were made from the NK cell transfusions in patients. So several models have been proposed in the last 20 years, I would say. And some of these models have been published in the most high-ranking journals like New England Journal, Blood, the Journal of Clinical Oncology. However, most of these studies were moderately sized, covering 1, maximum 2,000 patients and their corresponding donors. And not a single of those models has been so far been validated in independent data sets. So when we started in the late in the second part of this the last decade, we aimed at validating those models, and we did this in a series of 3 subsequent studies, where we evaluated retrospectively outcome of transplantation in relation to the corresponding donor and the donor KIR genotype. The first study focused on patients with acute myeloid leukemia. The second study focused on patients with secondary acute myeloid leukemia, or MDS. And the third study was a a large study, again, combining data from patients with acute myeloid leukemia or myelodysplastic syndromes. Altogether, we analyzed data in these 3 subsequent studies on almost 9,000 patients and their corresponding donors. All 3 studies are by now published. The first was published in Blood in 2020. The second was published in Frontiers Immunology in 2021. And the third study was recently published again in Frontiers Immunology in 2024. We tested different models, some of them published and some of them building on own ideas, which we developed. But as I said before, we have not been able to validate those. And just to give you a little bit of let's say, an overview, we tested models building on haplotype KIR, haplotype motifs as a building block, and an approach to classify donor KIR genotypes. We classified according to KIR receptor presence or absence for single KIR receptors. We investigated more complex models where the KIR receptor ligand interaction was analyzed. So the KIR receptor come from the donor and the ligand being present essentially on the HLA molecules of the patient. And we also investigated models which have been proposed which integrate information on several activating and or inhibitory receptors, KIR receptors. So if you look especially into the second and third publication, you will see, especially in the supplement, huge tables which summarize the validation attempts covering these different models. So we attempted to test all models which have been proposed so far. And once again, the surprising result was that we have not been able to validate or to find one consistent model which allows prediction of patient outcome with respect to mainly, to be honest, mainly relapse after transplantation, because this was the endpoint which was most promising from first research. But also with respect to overall survival and non-relapse mortality as, let's say, secondary endpoints, which we analyzed. One endpoint which has not been studied so far thoroughly is graft-versus-host disease. There's new work going on which aims at trying to predict graft-versus-host disease, the risk for graft-versus-host disease based on the donor KIR genotype. This might be promising still. So we conclude for the time being that there is no land in sight, that we at least did not find the clue, and those models who have been proposed to be the clue could not be validated. One important issue in this context is that we were only able to do this research because we had access to the repository of a large biobank, and this is the so-called collaborative biobank. This is an initiative building on the collaboration of German transplant centers and collection centers. This biobank is supported or mainly administered by DKMS. So without DKMS, this would not have been possible. And in the meantime, in the last decade, more than 50,000 donor samples have been collected in this biobank, and paired samples of patients and corresponding donors of almost 5,000 donor recipient pairs. So it is a growing research resource for research. And what is very important, this is open. It's open for researchers from around the world. And I would like to invite you to to study the website of this biobank. There you can find information how to access such research samples. Just go to www.kobe-biobank.de, and there you might find additional information. Often, this is one last thing, we can provide the samples, but the data have to be retrieved from either CIBMTR or EBMT as the major transplant registries. But this is a feasible combination and a good way to collaborate and use access to samples, and at the same time collaborate with the working parties from these large transplant registries.